during these times, the importance of associations and relationships with our members is more important than ever. So even though it's been tough economic times, it's really been a time of personal, professional, and organizational growth for what we do. So before I get into the a few slides I wanted to share and some discussion about current events and things that are happening and what I expect to happen, and some of the main pressure points in the system for where public policy is, the public policy debate and discussions and some of the regulatory decisions I think are likely to take us. I wanted to give a little bit of context. So the stuff that people see is the outward facing advocacy. We try to impact rules and regulations and laws at the state and federal levels. And we do so in an intentionally bipartisan way. So SBAM is I won't say that we're nonpartisan, because we work in a partisan world. So we're bipartisan. In other words, we go out of our way to make sure that we have strong working relationships with people across the board. And that means that I could call Gretchen Whitmer right now, or I could call Jason Wentworth, who's the Speaker of the House right now, and either one of them would pick up the phone. And it's important to us that we have that type of relationship with people across the board. So intentionally bipartisan, but that's the public facing part. It's actually a relatively small part of what our organization does. So staff wise, it's about, 10% of the staff that works on advocacy level issues. We also do insurance and best practices and compliance education, energy efficiency services. I think we're the biggest COBRA administrator in the state. So we do a lot of other business services things. And that's really the girth of the organization. The public facing part that you would all see is the advocacy work. It's stuff that I'm personally very engaged in and love to do. So I'm going to share my screen to talk to just run through. Basically, I've got two objectives here, and the first is just talk about current issues and the main issues that I see kind of in the near term that we will be dealing with, and then I want to run through the new workplace safety rules and point out a couple of things and provide a little bit of context moving forward. So first thing is that permanent MIOSHA workplace safety rules have been withdrawn. So this is a pretty big deal. We had raised alarm bells when the proposal went forth to initiate permanent workplace safety rules. We knew that what they proposed was not what they intended to get, but as a practical matter, we knew that we were getting pretty close to when the governor is going to allow the public health emergency order to expire, and the idea of having permanent rules that would take effect after October 14th of this year was just something that really kind of struck a nerve with our membership. Had a lot of engagement in the public policy or the public comment period, and so thankfully those have been taken off the table. So really, I think a big win for small business on that front. The workplace safety rules, the emergency workplace safety rules, the ones that we've been operating under since October of 2020. Run through October of 2021. These are different than the DHHS epidemic emergency orders. So the workplace safety rules are the ones that apply mainly to your employees. The epidemic emergency orders are mainly for places of public accommodation and for broad population-wide rules. So the emergency rule set, this is one that it has been evolving. There has been a big change, a very substantial simplification of those rules. That's not to say there's no issues with it, but big step forward in the emergency rules. And that's what I'm going to cover in a few minutes. But the big question is, the second and third bullet point, you notice the MIOSHA workplace safety rules go through October 14th of 2021. The DHHS emergency epidemic order is set to expire on July 1st. And the governor has said publicly, and I think without any kind of backdoors or escape hatches, that she's going to allow this epidemic emergency order to expire. And that means the population-wide requirements around masks and capacity limits, they will expire at that time. So that there's been a pretty quick change in terms of, you know, the outlook in this area. So one of the big public policy questions in front of us is MIOSHA really going to have emergency workplace safety rules for COVID that live longer than the public health emergency orders, right? So that's an important question that's out there. Legally, technically, they can exist independent of each other, but it's certainly kind of an awkward position to put MIOSHA in, to say, hey, you're going to enforce emergency workplace safety rules when DHHS has let their emergency order expire. So that's a big question. In terms of feedback from our members, now that we have a date certain when capacity limits will be lifted, workforce shortages has very quickly risen to the top of the feedback that we hear from members, and to a level that I don't think we've ever heard before. You know, in 2019, we heard a lot about shortages and difficulty having people even apply for jobs. I've got a ton of anecdotes about raising wages and benefits and bonuses and things, and just not being able to get people to even apply. And again, it's anecdotes, but when you're an organization as big as us, our anecdotes really do add up, and I think they mean something. And so this notion that it's bigger than just what the wage that people are offering. You know, when restaurants are offering $24, $25 an hour for cooks and can't even get applications, that exceeds the unemployment benefits by by about the equivalency of $8 or $9 an hour. You know, the unemployment benefits are the max benefits would equal about $16.55 an hour if you consider them like a 40-hour a week equivalency, and so just beating the unemployment rate is not enough to get employees. And it kind of makes sense if if what you value is time off, or you have other barriers to getting back to work that have nothing to do with the income or have little to do with the income, then just offering more wages is not going to make a difference. And in fact, that's what we're hearing from the industries that are kind of last to the table to bring workers back, is that they're having a hard time finding them in the first place. Now we know that work search requirements are going to be added back to the into the mix May 30th, so just coming up in a few days. In other words, to remain eligible for work for unemployment, you have to be searching for work. And we don't know a lot about what the accountability is in terms of enforcing that, but that is bringing back a mainstay of the unemployment system that has been waived ever since March of 2020. So that's a pretty big development. I think it will make some difference. The additional $300 a week from for the feds will end at the end of the summer. Unless it gets extended, which it could, but that's, those are three kind of lever points. Also, we're more involved in childcare than we ever have been, recognizing this as being, particularly among women, a huge barrier. If you look at the re-engagement in the workforce, you see that the re-engagement is furthest behind among women with younger children. And so we know that this is a critical area. We do consider it part of our agenda to help solve the child care access and affordability of quality child care. And then there's vaccination policy decisions that are being made every day, is really kind of put employers in a sticky situation. I'm just going to run through. The rules are actually quite short. I'm going to run through really quickly and just point out certain things. First is, and the definitions of the MIOSHA workplace safety rules. These are the amended emergency rule set. So these are the ones in place until October 14th. So fully vaccinated persons is a definition now that appears in these rules, and that is because there's a difference between the regulations as it applies to those vaccinated and those not. So obviously that is a brand new standard in workplace safety rules, and that most employers wouldn't have any experience with. And so we're kind of learning how to manage through this in real time. So 2 weeks after receiving the final dose, if it's Johnson & Johnson, that means 2 weeks after the first and only dose. Moderna and Pfizer, 2 weeks after the second dose. You still have to have a preparedness and response plan. If you do not have one of these and one of your employees complains and MIOSHA calls you, the first thing, guaranteed, the first thing they will say is, we would like to see a copy of your preparedness and response plan. We've received a complaint. We'd like to have a copy of your preparedness response plan. This is required by the regulations. It has been the whole time. If your answer is I don't have one, you're going to get a fine. I promise you, right? So we do have a template for free. You can go to sbam.org, find our emergency or our COVID-19 preparedness response plan. We try to make it as easy as possible, fill in the blanks, plug and play, and it'll tell you exactly what you need to have in the plan and make sure that if you do have an employee complaint, that you're covered. But that you at least don't make it easy for them to decide to give you a ticket. So number one is you still have to have one of these. You've always had to have one of these, but you still have to have one of those. There are certain things that apply across the board. They do still have the sanitation and hand washing in the orders, some kind of common sense type stuff. I think this is one of the less intrusive, assuming, sometimes like a construction site having running water, or it's a little bit more complicated, but for most settings, this one's pretty easy to meet. But you have to require those experiencing symptoms COVID-19 to either work in isolation or not report to work. That's another. It's actually one of it'd be interesting which of these rules will be permanent in terms of workplace safety rules that are adopted. Something to do with screening, or people sick not reporting to work. I could see there being a possibility. There's one of the few things in the rules that might persist over time. But look at number 3 here. The employer shall increase facility cleaning and disinfecting to limit exposure to COVID-19. That's the kind of official or the scientific definition of it, in accordance with the latest CDC guidance. Okay, so CDC has changed their guidance in this area. They've actually suggested that that surface-to-surface transmission is not how this vaccine works. And so, but when MIOSHA put this in there, a reference to CDC, I think basically what they're doing is they're pulling through and saying, you don't have to do all these what people have come to call hygiene theater now. You don't have to do all of those things that you had to do before. You got to stick with the CDC guidance, and the CDC guidance is not very explicit, and it's not heavy like the previous MIOSHA workplace safety rules were. Then in terms of health surveillance, this is another one. You still have to do health screening. So this is asking people, the questionnaire, have you experienced any of these symptoms? And then if the employer shall direct employees to promptly report symptoms. This is the same as it was before. And then you have to either have the employees have symptoms isolated or not be or not report to work. So the one thing that's a little bit different on here is, there are some masking differences and distancing differences that we'll talk about in just a moment. But that is the difficulty is that what this doesn't say is, what if a fully vaccinated person fails the health screen for a reason that, whatever, maybe I'm a smoker and I got a cough or allergies or whatever. I mean, there could be other reasons, or even if you just have, you're sick and you have the flu, most of the time you would not stay out as long as COVID-19 quarantine requirements would suggest. So what if I'm a fully vaccinated person, I fail the health screen? Do I really have to stay out so long anymore? That's one of the questions that we're trying to get to the bottom of, is what are the regulator expectations and that on that front? What are people supposed to do? But down here, another thing that we like, there's a CDC reference. So in terms of a known or suspected case of COVID-19, you can return to the workplace only after they're no longer infectious, according to the latest guidelines from the CDC. In the past, the CDC shortened the guidelines, and the state didn't adopt the CDC's shorter guidelines. And so our employers were left with 14-day quarantines for a while, and till the regulations caught up with the CDC changes and the latest science. And so that automatic flow through from the CDC is actually a pretty big win here. So I just wanted to point that out. And then employers, you have to have your work site safety coordinators. That is still a requirement. As we come back to the office here at SBAM, there are 2 of us that have that designation. We're going to, probably about a quarter of our staff are going to be coordinators, to make sure that there's always somebody here. It doesn't explicitly say that a coordinator has to be there when other employees are, but we think it's inferred or implied. And so that's what we're going to do, is we're recommending others do. Those are the people that are supposed to know the plan and be able to answer questions and deal with problems that come up. So, but here's where it gets a little bit sticky. The employer shall ensure that any employees except fully vaccinated persons remain 6 feet from one another. And then number 4, the employer shall require any employee except fully vaccinated persons to wear face coverings. So here's the thing is, they're asking you to know, and so thankfully they give some examples. They say to comply with this, you can do something like, take a look down here, keeping records of whether people are vaccinated or not. You can just post signs and have a policy and make sure that your people know about the policy and not ask, right? So you can still require remote work. So they give some examples that are not particularly, they don't require you to be intrusive. But here's a new term, a term of art: compliance with subrules 2 and 4. So employees that aren't vaccinated have to be distanced. Employees that aren't vaccinated have to wear masks. Okay, so compliance with those 2 things, 2 and 4 of this rule, may be accomplished in a manner deemed effective for the place of employment. That's a new term, deemed effective. What does it mean? I do not know. Nobody knows. This is a brand new one. So now when I asked about that, the idea was, look, we're not going to pre-prescribe what you have to do, but we expect it has to be taken seriously. And so it's not a don't ask, don't tell policy. It is, you can do these things, but you can't just ignore if you know that rules are being broken, like unvaccinated people are not following these rules. You can't just ignore it. But in terms of what are your risks? Well, your risks are you have an employee that complains, and they will be responsive to complaints. If you don't have any employees that complain, they're not MIOSHA not likely to ever visit you. So there are training requirements. So you're supposed to make sure that people know what the rules are, that you train them on that. The one that's a little bit, it's been there the whole time, but let's see, here we go. You have to train your employees on steps the employee must take to notify the business or operation of any, I'm sorry, no, that was how to report unsafe working conditions. So you have to train your employees on how to turn you in if they feel that you're breaking the rules. So, and then record keeping is the other thing. So the health screening is the big part of that. That's when I've seen the tickets handed out, it's often because health screening wasn't done, or there was no evidence that health screening was ever done. So those are that's really the presentation. I just wanted to run through the workplace safety rules. I thought they were stunningly short. First of all, they did scale them back quite a bit. They took all the industry specific stuff out. They've added in their references. They do give a lot more leeway. I've got a couple of later on today in our small business briefing on Facebook Live, we'll have a couple of business owners that took those rules and implemented different mask policies. One of them that said, we run a restaurant, our servers, we got together, had a team meeting. We're confident that everybody is vaccinated. And we decided that's our thing is our servers are not going to be masked anymore. And so we're gonna go full on with the max what this rule can allow. We're gonna have another business owner on today that is going to that took a different approach and said, look, I don't want to even open or breach the conversation of whether or not my employees are vaccinated. I'm just not going to do that. But what these rules give me the ability to do is say, okay, you only have to wear a mask if you are either unvaccinated or can't maintain 6 feet of distance. So I'm going to say, and this is a factory setting, it's not a factory, but a production facility. So in this case, it's like nobody has to wear a mask unless you're consistently within 6 feet of people, which is also compliant. So what he's saying is, vaccinated or not, if you're working in close proximity, you're still going to wear a mask, but the vast majority of people aren't. And I'm not even going to ask about vaccination status because we're going to go as far as we can, assuming that nobody's vaccinated. And so those are a couple of different approaches that two different business and very thoughtful, successful, professional, compliance-minded business owners have taken. So, the reasonable differences here. This might only matter until July 1st. Maybe my OSHA workplace safety rules will be limited at that point, or maybe they won't. So that's a big question that's out there. We will be advocating for the workplace safety, COVID-specific workplace safety rules to end at the time that the epidemic emergency order ends. And we think that's a very reasonable position. We think it's a little bit strange that we would say all mask and distancing requirements go away for the entire population, except for when you report to work. And so we intend to advocate that way once, now that we're into this kind of final phase, if you will. I would normally start out with when I talk to a group to set context, I would start out with, here's where we are in the disease spread. The Michigan Economic Recovery Council, which is appointed by the governor, has produced reports weekly for the last year plus. And the same reports that the governor looks at. I've always shared those because it gives us some insight. Here's the information the governor and her team are looking at. And so we can kind of try to predict or forecast what the possibilities for the future would be. Right now, in every single trend, save for vaccination rates, it's going in the right direction. So positivity rates have fallen, which got pretty high, have fallen now the last few days around the 5 or sub 5% level and still declining. The epidemiologists like to see it below 3%. It's headed to below that. I think that we're going to be at pandemic lows here real soon, looking at the trajectory of it. Hospitalization is down about 2/3 from what it was just a month ago. And in terms of the vaccine impact on lives, this wave, which infection-wise about the same as the one in the fall, so far 2,000 fewer deaths associated with it. That's the power of the vaccine. So the most deaths associated with people that are older, those are the ones that are most vaccinated, and so it's proven to be highly, highly effective, and it bears it out. The data is borne it out very, very clearly, and so, but deaths declining sharply, hospitalizations declining sharply, positivity percentage declining sharply, overall case levels declining sharply. I think it's going to be much lower than it was last summer. There's a big question: what's going to happen in the fall? I think that's a fair question. So, is there going to be a variant? Is having 40%, I think it's going to be 45 or 40% or so of our population will still be unvaccinated. Will that be enough will there still be like a fall wave like we had last year? Maybe. I mean, there's a lot of question marks left in this, but clearly we are heading into a low risk period. Summer was low risk last year without vaccines. And so I think we're heading into a point where I think this is the right time to really back off on the rules, knowing that the government still has all the emergency powers that they had before. And if they need to reinstitute something, when I talked to the governor's team, my advice on this was, look, you're going to get better compliance in the fall if you need to ask for something, some kind of emergency order, if you give people a break right now.
Yeah.
And yeah, so that's kind of the one of the points really, I think, in terms of preparing for the fall. I think part of it is to say, recognize, look, we're at a low risk period here, and we need to take advantage of that to get economic resiliency back, to give people a break, to just kind of let us rebuild some of the resiliency that has been worn down over the last year. And then we'll approach the fall, and hopefully it won't be a problem. But if it is, then I think we'll be in a better position no matter what direction the government decides to take at that point. I'll stop my comments there. Happy to, I don't know if you have the format, Roger, if you got some questions or other things you want to talk about, I'll invite you to, anything you want to talk about is fine with me.
Yeah. So having sat in on a lot of those briefings, the analogy I'll draw is almost like you guys were almost like the ESPN announcers of the data. Let's pull it up, let's look at it, and you could pretty reasonably predict what was going to happen next week based on what you would be talking about this week. And
Yeah.
it played out that way. And what was really interesting for me was to watch how you guys would try to predict what the state government was going to do in reaction to what you were looking at.
Yeah.
In your analysis now, having the long tail of looking back over it, there's a lot of emotion about when Governor Whitmer made this decision to sort of just follow the CDC guidelines out of the blue. And what I really want to know from your perspective, given such a close seat that you had to the data, was that tail end of what happened here a surprise to you, or was that pretty consistent with how you'd seen her react up until that point?
Well, the real surprise was the way that the CDC moved. It was clear to me that the CDC did not give a heads up to anybody around the country, because there were no states that still had substantial controls that appeared ready to react to the CDC change. Now, if you were to look at the CDC's own studies, their own data that they were publishing, it supported the decision that they made, very, very obviously. But they kept on putting caveats. They had things like, they said, it was an interesting profile in the New York Times where they said, where they were talking about the kind of the way the CDC has been communicating. They said, well, we think that there's less than a 10% risk of transmission outside. Therefore, we can reduce outside restrictions. Well, but the actual 10%, the actual risk of transmission outside is way, way less than 1%. So they're communicated as, since it's less than 10%, well, 10% is actually way different than 1/10 of 1%.
Right.
And so it's created this strange scenario where they're communicating in a way that where there's enough actual risk out there that you don't have to downplay the places that turned out to be much less risky. And it's created a lot of confusion and changes. But it wasn't a surprise to me that the governor reacted to the CDC change. So the CDC change so abruptly was a surprise to me. The fact that that the state and the governor and the public health director felt that they had to align with the CDC rules was not a surprise for two reasons. First is that more than half of states were ahead of the CDC already. So there was already kind of a nationwide movement toward this, dates certain, we're going to end public health restrictions as of a certain date. And then the other thing was looking at the way states that had Democratic governors were reacting to the CDC guidelines told me that it was kind of a groundswell. There's just no stopping it, right? Nobody was going to like go against the CDC rules. And so then it really became a question of how do we implement this? This now standard over say, okay, one set of rules for people with vaccines, one set of rules for people without vaccines. quickly, I think that the change in Michigan would have happened sooner had it not been for the fact that they probably had a vigorous internal debate on whether or not they wanted to try and enforce the difference between vaccinated and unvaccinated.
Yeah, it's the fracture that's there, and it's really both sides of the aisle when they're upset about something they've been pointing at like what they consider to be unfair behavior for the other folks. And so now you have rules that apply to different sets of people that can vary in their application and even the way that they're being enforced. So it's going to be an interesting summer for a lot of us. But I think if you look at the circumstances that comprise the economy, other than to me the two, other than we have the problem with getting people back into the open positions, but then we have a supply chain problem that we need to unlock as well. So those of us who sell things, oftentimes once we get the sale, we go to get the stuff that we're supposed to sell and it's not there. And there's a lot of that that's going on in the supply chain as well. So those two things to me, I see as kind of the two really tough things to tackle. Do you see a third in that mix from a small business perspective that we might want to keep our eyes out for?
Yeah, I mean, I think there are several things that are going to cause a churning or a disruption, and probably a better word, that are not likely to just settle back. So the disruptions on supply chain, I think, will generally work themselves out. But I also think that there's, reshoring is going to, there's going to be a strong argument for reshoring things after this pandemic, right? This is, people have known there have been risks, and we're going to be moving on, right? So we've got, high percentage overall vaccinated. Put that together with people who have more natural immunity and the virus in retreat. Other places around the world are nowhere near that, and those places are part of our supply chain. So that's why I think one of the kind of unintended potential benefits is that more reshoring of important things there's a stronger case than ever for that to happen. But it'll take a while for that to work out. Getting employees back, I think I think that's actually going to change pretty quickly. I think at the end of the summer, by the time you have work search back and you end the federal benefit, you're going to see that change pretty quick. But the things that I don't think are going to change very quickly, the patterns of life. I mean, how and where people work. There's a whole ecosystem of business that exists to serve office workers. It could be retail, could be restaurant, could be dry cleaners. There's a very substantial ecosystem of business that's what they do. And if office workers remain fairly dispersed, the entire kind of business model of how they get business and where they're physically located is going to be quite a disruption. Obviously, in the commercial, the commercial office space in particular, there's going to be, I think there's going to be a lot of repurposing in that. There's some movement nationwide right now on modifying the historic tax credit to allow for the, it's a 20% credit to put that into, or allow for the conversion of office into residential. And there is a huge need for residential in a lot of these areas. So I think there's probably going to be legs to that. Those are a few of the things I think will be difficult, and then just the overall recovery of industries that were most restricted. It's just going to take some time. So restaurants that are about service and experience, the stuff that didn't just translate over to takeout and delivery. That was the hard part to get the people in the government making decisions to understand is if your real product is the atmosphere that people are eating in, not the actual things that people are eating, you can't just, that's not going to translate to carry out. That's not the actual food is not the main product. No. And so those types of businesses, their recovery is only just starting. So for so many industries that have been off and running and gotten back and they're on their way, I think it's important for us to realize that the recovery is not uneven. The top line economic numbers are pretty good, But inside of that are many industries that are, they're only just now getting to a place where they can begin their recovery.
I believe another friend of yours that's in the gallery today has a question for you.
Hey, Brian. Joe Mark.
Hello. Yeah. Hey,
You know,
Joe.
I know we've had some exchanges. I want to thank you for communicating with me directly on some issues back in the winter. And, I think the one frustration I had, as you know, is that if it bleeds, it leads. So when there was good news happening and good progress happening in the COVID epidemic or pandemic, it wasn't really being reported as much as the bad news. And so I appreciate your feedback on that. But my question is, I kind of fit in a donut hole that's not really addressed in the rules that you shared here. And that's that I was a victim of COVID and recovered, and I've got antibodies, and my pulmonologist tells me do not get the vaccine. He's had several patients go back and even some die after receiving the vaccine because they had antibodies already. And so it's not really addressed in any of the rules that I saw. Do you have any insight into that and what the MIASH or the state has to say about it?
Well, I would say that there's generally a what I consider to be a puzzling apprehension to consider the efficacy of natural antibodies. This is another area where the CDC's own data has strong evidence to suggest that natural antibodies are effective in preventing reinfections and spread, and which, I mean, that's how the immune system works. So it's not like this is a big surprise, but they do have there's growing evidence of that being true. But there is a major apprehension, and I don't understand it. Why if you're going to say vaccinated versus unvaccinated, it's easy enough to have an antibody test to see if you have those antibodies. And so why wouldn't that, you got a vaccine card, why wouldn't the antibodies test be just as effective?
I'm going to listen to my pulmonologist over the government on my health. I mean,
Sure.
it's
yeah,
not a question.
Yep. I think it's important to mention that our state does not, the laws in our state do not require people to get vaccines. I don't anticipate that will change.
But would I have to subscribe to the rules over unvaccinated people? That's the question.
Right. Yep. Yeah, exactly. And the answer is, at the moment, according to the rules anyway, yes. The EEOC did.
I get a double hit, right?
Yeah.
I get hit with the virus, and I gotta do the antivirus stuff.
The EEOC took this up, and they and because equal opportunity and different rules for different employees, and not surprisingly, they said that if there's in pandemic-like situations, they've got specific legal standards for it. But in those situations, different rules for different employees are legal. And but that's it. I don't know why the apprehension is there. The CDC's own data I think has just as much evidence on natural antibodies. It's one of the ways that they fight when somebody has COVID. They take the antibodies from people who've had COVID and inject them into.
It's the ultimate vaccination. Okay.
It's I think that there are important questions that are asked or that they're researching, which is, the vaccine is based off the original virus, or at least an early iteration, the earliest known iteration of this virus. So all of the mutations or the variants of it are from that original virus. So the vaccine, it's not a surprise to anybody who's honestly looking at it that the vaccines are effective against the virus and all of the first generation variants. But if you got a first generation variant, now you're 2 steps away from other variants, right? So you got to go to the original virus, and so you might have antibodies that are far superior. If you have the B.1.1.7 variant, your natural antibodies are far superior, probably, than the vaccine antibodies are for that variant. But what's not known, or the caveat, the asterisk on it, is are your antibodies as effective against the Brazilian variant or the South African variant? That's the asterisk that I think at least has some basis on it. But again,
Is it mostly political?
yes, I do believe that there's that the apprehension is like they want everybody to get vaccines. They don't, they don't want to have another reason for people not to. So I think they're reluctant
Yeah.
to admit that natural antibodies are also effective.
I was on a
don't
leadership council meeting back in I think it was January, and I was being urged to take the vaccine by the person that came to campaign for the vaccine in the state. Who was that person? She was an author, a pediatrician. Do you remember?
Oh yeah, Mona Hanna-Attisha.
Yeah, she was insisting I should take the vaccine counter to my doctor's order. So I thought that was
but I think that you always have to keep in mind that broad public health guidance, but people that have particular acute conditions are going to be the exceptions to the broad public health guidance.
okay.
Yeah.
Fair enough. Thank you, Brian.
Yeah.
So I think Chuck had a question.
Yeah. Hey, Brian, thank you so much for joining us today. Really appreciate you doing this. I've really enjoyed your presentation. I was just thinking, I was talking to a couple of friends the other day about this. I'm a little concerned. So many business owners that I know are so desperate for workers right now. I mean, everybody, I run this newspaper and everybody is calling me and saying, hey, I need to run a want ad. I need employees. And I feel like we might be in this strange situation where we go from this moment where everybody needs employees and everybody's there are so many people who are taking advantage of the unemployment benefits that are available right now. And that's about to run out, right? For so many people, it's going to run out anytime between May and September. And obviously it's becoming more difficult to be on unemployment. I feel like we might be in a situation that's exactly the opposite in just a few months, where all of a sudden, all of those jobs get filled and people have downsized their business and figured out how to run a little bit leaner. And we might have a situation where we have real unemployment, not unemployment created by the virus situation reaction to it, but unemployment that's based on jobs that just aren't there anymore. Do you sense that coming?
Yeah, I mean, I think that's very insightful. And the thing is, like, these are the times that drive efficiencies. And so just different decisions are being made in terms of scope and operation and practices to just deal with the current situation. And then there's also going to be, you kind of have this rush back and things are going to, things will settle. And so I do think there's a risk that people that are on the sidelines right now, that by the time they decide themselves or government rules changes, and so they have to re-engage, that they're going to miss some of their best opportunities. So there is absolutely a risk of that. As they say, productivity is the enemy of employment. And I think that there are a lot of places that are figuring out how to be more productive. And but I also think that, I was at a place last night. We had SBAM had our first in-person event since March last night, and the owner of Cleats Bar and Grill here in Lansing that was running it. I mean, she was picking up stuff at tables. She was running the pouring the drinks. She was, I mean, and it's tough. It's tough to find people. We had another one, happened to be a restaurant owner that was planning on being there, a sponsor and everything, and just said, I can't leave because I don't have enough employees to run my business. And so, but what's happening is, we were looking at the, hours. We're really happy that as of June 1st, the curfew goes away. And, but we've had some feedback saying, yeah, it's nice, but I just don't have employees to expand my hours right now. And so, as they start to figure out, okay, well, what are the most profitable hours to be open, and how do I make this work? And then some of them are going to find permanent solutions. and solutions that don't require as many employees to come back. So I think it's one of those things that are going to have to settle, and we'll see how it goes. But I don't think there's any chance that in our state the federal portion of the benefit will be ended before it expires at the federal level. So you do see a lot of states. Actually, I think we're up to, last time I saw, 26 states that have either already done it or picked a date before September to say we're not participating anymore. But I don't think there's any chance it's going to happen here. I think there's a strong case for it, but being realistic, I don't think it's going to happen.
Yeah, Chuck, I had a question there. I just sent a chat message, curious about SBAM and electric choice. Big issue as renewable energy comes on. I wondered if Brian, you might be acquainted with the economist at Hillsdale who wrote for Conservative Forum that paper about open access, and the problem we have by not having choice and having 90% automatically of generation automatically owned by the investor-owned utilities, and not having municipals able to get into choice aggregation or to try to do stuff themselves for their citizens. I know Washtenaw County is pretty big on that. We wish to move that direction. It's called community choice aggregation. And there's a couple of trade associations working for that, pushing, because if we could, it might be a way to get a little choice going. I know that it was big. I think Engler did a great job bringing choice, making it possible. And I was real disappointed in 2008 when Granholm took the deal with DTE to restrict solar to only 1%, third-party owned solar, plus choice could never exceed 10%. They have the right forever to own that generation, and it's not the regulated side of the utilities; it's just the investor-owned side. So to give that kind of monopoly power away, I really liked the Conservative Forum's paper by that economist in Hillsdale, Wolfram, who said it just messes the market up to give that kind of monopoly power away. And seems to me like small business guy like myself, with based here in Washtenaw County, but it's really a bipartisan deal to try to get choice back in the picture. And I think maybe this push that's coming for community choice, for like a municipality could do something, put it on their landfill, and they could let others, and they could be allowed to interconnect, but of course can't do that. And I wondered if across the whole argument, like Abate could, the big guys could get behind this too, and SBAM could hook up with the trade associations that are trying to do this, and we might be able to make something happen.
Yeah, we've never been terribly active in the energy policy space. We do have some existing policy when it comes up, anything that touches subsidies and subsidizing. So, we just don't like certain people having to subsidize other people's energy choices. But that's one kind of standing explicit position that's out there.
Where do you think the cross subsidy is happening?
Well, there was a period of time when like tax credits, for example, some taxpayers, are paying for other taxpayers' investments in other types of energy infrastructure, like those kinds of things. Like people make investments, they can stand on their own, and one business owner saying, "Don't charge me, don't have to charge me higher taxes, so somebody else can, you can pay for somebody else to make an infrastructure change for their own business."
That's not happening though.
No, I know those ended back before. I was just giving that as an example of one area where we've engaged, but in the past. That was actually pre my time too at
Yeah, yeah.
SBAM. So yeah, I do expect that some of those, more mainstream type issues will come back into play. But it isn't anything that we've engaged in anytime in the recent history, as we've been just, how do we get our businesses back opened, has been kind of our all sing in unison on that same
Yeah.
type of a thing. But no, I do appreciate the insight on it and the heads up that I had heard. I know that some things were moving. I know there's a little bit of arguing happening at the Capitol on a net metering issue that is in one of the House committees right now. And so I mean, it's something just because I've been in public policy so long. Yeah, I keep track of these things.
That I think that's the 1%. That 2008 law that gave the investor-owned utilities 90% ownership of generation, all generation in their territories forever.
Okay, David.
Also gave them the 1%, the 1% limit for solar. So that's for what they're going for, to lift that cap, so.
All right.
Okay, Dave, interest of time, we have just about 2 minutes left, and we do have one question left. Tim, you had a question that you wanted to ask?
Sure. Yes. So I talked to a lot of small businesses. And by the way, Brian, Joe, Dave, these are all great stuff. Tons of great information here. So Brian, my big question is, I talked to a lot of small businesses. A lot of people are on the fence about the vaccine, and there's so many different types, and now I'm actually hearing of new medicines and new ways that can actually kill the virus, where you don't have to get, and like Joe was saying, there's other antibodies and things that are available. Is there anywhere in the government that's saying that, hey, maybe we'll allow different things or different testing, like they said, antibody testing, to allow people to not have these restrictions versus like vaccinated or non-vaccinated? Because I don't want a label to start being put on businesses or consumers, whether they're vaccinated or not. So is there a way that we can sort of say, raise our hand and say, hey, as an association or as a group, we don't really want those restrictions, and can we put our notch in and say, hey, that's our vote? Is there any way to do that?
Yeah, I think that there's a pretty good chance that these rules go away after July 1st. I actually worked with our policy making committee earlier today. Just this morning, we had a meeting on this to develop policy. What happens after July 1st? So the public health epidemic emergency order expires. And the conclusion that it was across the board with our Legislative Action Council, or this task force of our Legislative Action Council, looking at vaccine policy, is that when the epidemic emergency order ends, then rather than say, antibodies out of count or this type of, plasma treatment out of count, we ought to just say that the differences that you have in your currently in the workplace safety orders ought to end. And so you kind of, as opposed to piling on, where you say, well, we have differences here, and now you can include antibodies, or now you can include other things. Why not just say the public health emergency epidemic order expired? We don't need workplace safety rules specific to COVID anymore. And so I think that's where I know that's where our position is going to come down. It's got to go through a little bit more process, but it's so consistent among our membership that works in this policy development area, and across the board. We're bipartisan. We have people, Republicans, Democrats, independents, and agnostics all involved. And this is one where it's really remarkably consistent that the best answer, we can put up with this between now and July 1st, but when that epidemic order ends at that point, you got to get rid of these COVID workplace safety rules that put us in a position to have to ask about vaccines and that. And when that, I think there's a good case to be made for it. And I also think the numbers, infection spread and all that is going to be at a place where it hadn't been since before this pandemic started.
Awesome. We'll put a big green WWBA color green around July 1st and see if we can make that dream come true. I want to, as we wrap up here, it's 1 o'clock. Thanks everyone for participating. Brian, I want to give you a chance to talk about the summit that's coming up in June as a last little commercial here for everybody before we say
Yeah, great. Thank you. So we have our annual meeting, which is which we do every year. Normally we do it in person, but it's on. We're doing it when we had to pull the trigger on this event before we figured we could do something in person. So it's going to be our last virtual event. It's the biggest one we do every year, and it's great programming. But we're splitting it between 2 days, so it'll be two half days on the 15th and the 17th of June, and really great, insightful, and fast-moving content. You will not get bored on this. So I would encourage you to head to sbam.org and register for it. We'd love to have you. You'll be among your peers, business owners. That's who we serve. So it's not just a room full of salespeople. It's the actual business owners that are our audience, and we think that it will it'll be among the most insightful programs that we've put together. So I'd encourage you to take a look at it. It would be something for everybody on it. Please do join us that day.
All right. Well, there you have it, ladies and gentlemen. Brian, thanks so much. We really appreciate it. And I personally will see you in the virtual rooms there on the 15th. So that concludes our WWBA May Wild Wednesday webinar. Thanks, everybody. We'll see you next time.
Great day.